appropriate protocol, but there is $20 billion, most of which is incentives for physicians and hospitals that also was part of the Recovery Act investment, and work is underway to begin to develop the protocol for that system and have a platform to make sure that it's interoperable not only in one area of the country but throughout the country. The other expert who's coming in, who has been nominated and is wending his way through the process, is Dr. Howard Koh, who will be my Assistant Secretary of Health, and again brings a lot of expertise from not only the university side of medicine, but as the former Massachusetts Health Commissioner. We're thrilled to have that expertise as part of this new leadership team. So again, I just wanted to tell you that I'm happy to be a visitor here, but I have two people who will be at my side as we begin to implement strategies, who actually will bring lessons learned from here in Massachusetts and make sure that we adopt the best practices.
Great. Do we have time to open it up some? Couple questions. Yes, go ahead. Or comments, lessons.
See if I can talk loud enough without a mic. Okay, great. Thanks. That's a great transition for me to go into this. On behalf of the open source software solution providers in healthcare.
Maybe you could just give your first name.
I'm sorry. William Hochstedler. I'm with Medsphere Systems Corporation out of Carlsbad, California. I'm a Northeast Director here in Boston. On behalf of the open source software solution providers in healthcare and supporters of the derivative works of the Veterans Administration's VISTA EMR, thank you for the open and collaborative forum you've created here to allow all views and perspectives to be considered. It's broadly known that the healthcare environment in our country today is reaching a crisis state, not completely unlike the banking and credit markets crises that began several years ago. The system is strained like never before to maintain business viability, and in the midst of the strained economic environment with the additional pressures of the aging population and an ever-perpetuating inefficient care delivery model. Business as usual is simply not working and has not for some time. With the cost of healthcare increasing rapidly, many technology providers are taking advantage of those that are confused by how best to contain those costs. With hospitals operating on razor-thin margins and their leaders and business managers lacking the vision necessary to consider alternative solutions, each are following one another closer and closer to the brink of financial collapse. With our hospital system incapacitated and the notion of universal health care on the horizon, the crisis seems exacerbated. President Obama has acted quickly and meaningfully to stimulate change and new thinking with the high-tech section of the American Reinvestment and Recovery Act of 2009. The law correctly incentivizes those that are decisive in adhering to the requirement to move towards a more efficient communication model, such as an electronic health records, but falls short in highlighting the cost-effective way to achieve that goal. The requirements will outline the need for interoperability between technology providers to put relevant information on behalf of the patient in the hands of the care providers, but with proprietary methodologies, there will be reluctance to expose the necessary keys to interoperability. In April of this year, U.S. Senator Jay Rockefeller of West Virginia introduced legislation to recommend an alternative means for a cost-effective way to achieve meaningful use. The Health Information Technology Public Utility Act of 2009 creates an incentive for hospitals that deploy EHR solutions based on Veterans Administration's incredibly successful VISTA EMR solution. This $8.5 billion taxpayer-funded national asset literally transformed the quality of care provided to our veterans and has been positively viewed and actively used by more than 65% of the physicians in the United States completing their residency in the last 10 years. Our federal government created this solution and has made it available to taxpayers through the Freedom of Information Act website. The private sector has improved upon this powerful solution since its release into public domain, and several companies have spawned a new market for healthcare technology that leverages the government's assets and fosters an open, transparent, collaborative process to implement and support it in the commercial healthcare space. Most importantly, at a mere fraction of the cost of others. Senator Rockefeller's inspired bill, based on the success of the state healthcare system in his home state, is lacking support by the White House and others within the legislative branch, likely because it was reported by federal accounting agencies that the ERA stimulus law itself would achieve its goal of getting 70 to 80% of hospitals and providers to invest in the necessary technology today in order to capture federal incentives beginning in 2011. Interestingly, the law has created an unforeseen market dynamic. While vendors are certainly stimulated, the means to acquire the necessary technology to capture stimulus is simply not there. The costs are still too high, and the vendors are in a feeding frenzy to take advantage of the provider's incentive. The healthcare provider, and thus tax-paying patients, has become an afterthought. Large special interest groups and proprietary software vendors would be better served.
No. Let me ask you to come to the bottom line.
The question?
Okay. Just ask you to come to the bottom line.
So the question is...
I'd be glad to take that and seriously and give it to Dr. Blumenthal. I mean, I think that would be the appropriate notion because you have a lot of information that I can't possibly keep up with and take notes on, but I would love to have your testimony.
Sure, I'll certainly give it to you.
That would be great.
I got another copy. The question is, if you had any comments on open source solutions or on Vista and the VA systems and the way that it could interoperate with the rest of the nation, I had just like 3 sentences left, and that was the question. I just wanted to lead up with some background so you could understand.
So your point is that the VA system, the Vista system, is a solution in hand right now that ought to be used for to drive the health IT agenda. Is that a fair summary?
Yes.
Okay.
The other countries right now in Central America, South America, and Asia are already downloading the Vista code that the U.S. government created.
Got it.
And they're building the systems in other countries. We could possibly consider doing the same thing here and save a lot of money.
Okay.
Well, just to clarify, no decisions have been made, so the assumption somehow that we have ignored that and are not looking at it is not accurate. The 2 policy committees who will be looking at a whole variety of strategies have just been appointed, so this is very timely, and I will be happy to take it back, but there isn't money going out the door for anything yet because the platform is not in place, and this is exactly what the policy committee and the standards committee is going to be looking at. Thank you.
I have no
That's good.
comments I can have.
So I think the secretary is out of time. Am I right?
Maybe one.
Do we have one? Can we do one more? Okay. How about one here? Do you have written testimony?
I have a leave behind. I won't read the whole thing now, but thank you, Governor Patrick, for your leadership on the issue and the work that you've done in the state of Massachusetts, and welcome to Boston, Secretary Sebelius. I had one quick question about the role that you see home care playing in the broader Reform Act, and as we find ourselves in a hospital, it strikes me the Hippocratic Oath says, above all else, do no harm. Some of the legislation that came through under CMS's purview in the previous administration, like competitive bidding and some other things. I know Ohio Senator Sherrod Brown sent a letter to your office the other day. Just wondered your thoughts on the broader home care agenda, where you saw that. We heard some comments previously about the role post-hospital care, and I just was curious on your thoughts of home care in the broader Reform Act.
Well, I don't think there's any question that home health care is a critical component of a continuum of care system at all kinds of junctures. I mean, it will be part of the rebalancing for the long-term care initiatives to try and have more patient-centered care at home and in communities as opposed to nursing homes. It's critical post-hospital follow-up. There are, and often pre-hospital, as conditions get more acute. I think the challenge is to find the appropriate payment and the strategies that can drive efficiencies without jeopardizing benefits, and I think that's a robust discussion underway currently at CMS, but I don't think there's any doubt that if you have patient-centered care, there are very appropriate and less costly strategies that can be implemented at home with higher value for patients than in an institutional setting, whether that be a nursing home or a hospital, leaving those resources for truly folks who need much more 24-hour attendant care, much more acute care. So it's a critical part of the process. It's a critical component of care. Let me just say I am sorry that they're keeping me on the march. You have so much to learn about here in the Boston area. I've been given way too little time to do that. We do have a